From government and non-governmental institutions, the use of information, communication and technology in Kenya has grown to include innovations from an array of industries. The healthcare sector has not been left out on the bandwagon in embracing the opportunities that ICT has to offer. Athlete Alan Green was introduced to an online healthcare option by a colleague and experienced firsthand how ICT can assist in the provision of medical care.
For somebody like me who's also an athlete, experiences of being ill are kind of like an anomaly. So for the first time in like about 15 years, I kind of like fell ill some weeks back. Then I was like, okay, I got an MCare hotline. So I just called and all that, talked to the doctor, got driven over here and I got attended to. And for the first time I was like, okay, I think I know how this service works.
Developed by MCare Limited, the concept behind the medical clinic is to provide healthcare assistance to home-based patients and other individuals who are registered members of the clinic from a location of their convenience using their mobile phones.
It's a telemedicine center. We have a 24-hour call center. That means that any time of the day, whether it's at 3 a.m., whether it's at 3 p.m., you can, if you have a problem, you can be able to call the call center doctor and explain what your problem is. And using the very high IT platform, we are able to come to as close as a diagnosis as possible. And then from there, we are able to give you the medical treatment that you require.
E-health innovation comes against a backdrop of the continued evolution in the telecoms and ICT industry. Mobile phone penetration, currently estimated to be at 70% in Kenya, is playing a vital role in providing a platform for better service delivery in various industries.
You can also use mobile phones in healthcare to help you in logistics distribution, in ensuring that you can distribute drugs across the primary healthcare centers and the hospitals. And several African governments are using mobile phone as a tool to improve drug distributions at different centers. But also it can be used in anti-counterfeit, where the consumer can use the phone to check whether or not they're buying genuine drugs, and that can reduce reactions due to drugs. You can use the phone as a data collection tool and as a key component of a health information system. So for example, that means every day, for example, here in Kenya, Nairobi, if you had mobile data collection tools, that means every day in every village healthcare center, by the night in Nairobi, you can know how many patients were seen and what they were seen for.
Other than the convenience afforded, the use of telemedicine technology has its perks for both consumers and innovators.
We have a lot of static systems, okay? We have a lot of rigid systems that are not very, very, technologically friendly. And you go into a doctor, in most of the hospitals, it's a rigid procedure that you have to be able to go through in order for you to be able to be treated and taken care of. Look at a good example of how easy it is to be able to get in touch with MCare. All I have to do is just call the hotline, and there I have somebody to be able to attend to me. Then here's a better thing. If I find myself in a different country, all I have to do is just, go to the internet, use a password, and I can be able to get my medical records, and I can be able to go present them to a doctor if I need to be checked up again, so that the same tests are not repeated. So that's being interactive. It's being modern, it's relating to people.
I think I would put it as a threefold. One, the accessibility, it's a phone call away. Your doctor is a phone call away. And we also know that the statistics that for every one doctor, we have about 10,000 members. So we are saying that almost everyone who has a mobile phone can be able to access the doctor. We're also saying about affordability, because for a family of 6 with 300 shillings, you can access healthcare in this country. Then we are also talking of the quality. You'll be able to get the quality of healthcare throughout the country.
Its applicability, implementation, scalability, and uptake, on the other hand, cannot be ignored.
I think probably one of the big challenges is infrastructure. Not just related to healthcare, but to the economy more generally. So issues to do with power. If we're talking about computers and mobile phones, you need good sources of power for this to work. So I think sort of general infrastructure, the sort of cables you need so that people have broadband access, I mean, this is important. The other is an issue of cost. I mean, although I did say it can save money, usually in terms of capital expenditure, you usually have to spend significant amount of money up front. Like even the telemedicine system, it will take a significant amount of money to set up the system.
The paradigm shift from where if I need a doctor, I must see a doctor face to face, to now calling a doctor, I think that's been really the problem. You know, people are changing their mind shift from where I have to see a doctor to now I have to call a doctor.
Technological advancements from the chemistry innovation era in the 19th century to radiology innovations in the 20th century and now utilization of IT in the 21st century are indicative of the enormous opportunities that innovators have in the offing. For Eye on Kenya, I am Lois Washira.